functional medicine, bioidentical hormone replacement therapy, and also we offer medical weight loss. We have a nurse practitioner on staff who administers the medical weight loss program. Medical weight loss with the use of medications such as semaglutide offer an amazing opportunity for people to really jumpstart their weight loss. So I wanted to shoot a video just to educate people about how semaglutide, which is used in medical weight loss, which is the typical medication used in medical weight loss, how it works, how it actually gives the results. And the results are pretty amazing. Studies have shown that people on average utilizing medical weight loss will lose an average of up to like 32 pounds, whereas when they're doing diet alone, it's maybe an average of about 6 or 7 pounds over the same time period. So it can really give a jump start to lower or help people drop their weight and get healthier. There's additional benefits that people get. The studies aren't sure whether or not the benefits come from the actual weight loss or in addition to the weight loss, but the additional benefits are decreased risk of heart disease, strokes, kidney diseases, blood pressure, lower cholesterol. So there's a lot of additional reasons for people who are struggling with their weight to consider utilizing a minimum 3 month, maybe a little bit longer, 3 to 6 months of medical weight loss to really jumpstart their weight loss program. But let's dive in and talk a little bit about how the medication semaglutide works. In order to understand how semaglutide enables people to be able to lose weight, you have to dive into the science just a little bit. Not too much, but just a little bit. Semaglutide is a type of medication called a glucagon-like peptide agonist. Now what that means is it acts like glucagon-like peptide that our body, it's a hormone that our body naturally produces. So this medication, which is injected 1 time a week, generally starting out at a lower dose and gradually increasing for reasons that I'll talk about in this video. It acts like glucagon-like peptide within our body, a hormone within our body. So in order to understand how the medication works, you have to understand how that hormone in our body naturally works, or what it does. So GLP, or glucagon-like peptide in our body, it will increase insulin production. Insulin is the hormone that lowers blood sugar. That's why the primary usage of these medications is for people with diabetes, to lower their blood sugar. It works very well for that by stimulating insulin production within our body. It also will block the effect of a hormone called glucagon. So GLP, or glucagon-like peptide, blocks the effect of glucagon. Now that can help lower blood sugar and also help people lose weight, because what glucagon does is it increases blood sugar. So if you are taking a GLP agonist medication like semaglutide, you're going to be decreasing or blocking the effects of glucagon. And again, glucagon raises blood sugar. Elevated blood sugar is one of the core issues that a lot of people have as part of their weight loss issue. The body converts this excess blood sugar, or glucose, to fat. So when people's blood sugar levels are chronically or consistently high, they tend to put on weight in the form of fat tissue, because the body has to store that extra blood sugar or glucose in some way. It's toxic to our body to have the glucose levels be high. And so the defense mechanism, so to speak, is for the body to convert a certain amount of that glucose to fat. And so if you're blocking a hormone, which is glucagon, that raises blood sugar, you're going to be in another way lowering blood sugar. So the GLP medications like semaglutide will lower blood sugar by increasing the insulin production, but also by blocking glucagon, which raises the blood sugar. Again, this is why these medications have a primary use in blood sugar issues or diabetes. But they can be used for weight loss because of the effect. People will get a weight loss effect when they lower their blood sugar, both through raising the insulin and through blocking glucagon. The other thing that the GLP agonist medications like semaglutide do is they create a sense of fullness, or they make the people feel full easier. They don't get hungry as quickly, and it does that by primarily slowing down the time that the food is in the stomach. This is why, and this kind of leads to doing semaglutide and medical weight loss the right way. This is why it's really important to start low and go slow. 9 out of 10 times when someone has a problem of constipation or gut-related issues, which are possible side effects of medical weight loss with semaglutide, but 9 out of 10 times when they experience that, it's because they're working with a practitioner who didn't start with a low amount and raise it up slowly. That's key to medical weight loss with semaglutide. So in our clinic, our nurse starts at a good judicious low amount and then gradually increases once a month, checking in with the patient, measuring the vitals, blood pressure, percentage of body fat, overall weight, and things like that, doing nutritional counseling too. We also offer in our clinic the option for people to do functional medicine plans along with the medical weight loss. That really is the ideal way to approach a weight loss program, is to not only take advantage of these tried and true GLP-1 agonist medications like semaglutide, but to combine that with really in-depth laboratory work to identify hormone imbalances and other issues that can contribute to not only a difficulty in losing weight, but just a decreased quality of life because of energy levels being low, like if there's undiagnosed thyroid problems or iron deficiencies or any number of things that we typically are able to identify with the in-depth lab work that we do. So we always, recommend to people when they do the medical weight loss program that they consider doing laboratory work, more in-depth laboratory work, to do a functional medicine plan. There's always laboratory work that's done in conjunction with the medical weight loss patients who are having semaglutide administered. But when we do a functional medicine plan, we dig more deeply and do more extensive lab work. But that's how medical weight loss works. A lot of people don't realize exactly what's happening. It's the use of these medications, which are glucagon-like peptide agonists or mimickers. Again, GLP, glucagon-like peptide, being a hormone in our body that creates those effects of raising the insulin, blocking the effect of glucagon like we talked about. The injections are done once a week. They're really, really easy. We always encourage people that the nurse does it the first time and then once a month thereafter, and with in-office visits. Only a small percentage of people really want to come into the office to get the injection every week. It's just way more convenient to do it at home. So you don't have to worry about an excessive number of visits coming into the office because the injections are really, really tiny needles. You hardly feel them. But we have patients come in once a month to measure their body metrics like I talked about, and to make sure everything's progressing along as we would expect it. And then the nurse increases the dosage gradually, again, to avoid those gut-related symptoms that sometimes can't happen on a semaglutide weight loss program. So it works really well. It's a really, really good option for a lot of people. Not everybody. There's certain people who, if they have a history of what's called multiple endocrine neoplasias, which is where they have multiple tumors within different endocrine glands of their body, or certain types of thyroid cancer, makes it so that the person probably would not want to do it. It kind of excludes a person from that. Studies have shown, not in human studies, but in animal studies, that with those two medical issues, it was worsened. So just to be safe, when people have a history of that or are known, or they know that they have those two issues, which we screen for, then they wouldn't want to do that. But otherwise, for a lot of people, it can really be a deal breaker. It can really be a huge icebreaker, not a deal breaker, but an icebreaker. It can really jumpstart their weight loss. And then from there, it's not indefinite, or it's not for an indefinite amount of period of time, but we recommend minimum 3 months. Some people need longer to get the optimal results, but then we transition them off of that. And if they're monitoring or if they're implementing the lifestyle factors and dietary counseling that our nurse and myself give to them, then they're able to maintain these incredible weight loss gains or incredible weight loss achievements for a long period of time.